Hello. Well, you're just beginning to learn how to use ICD-10-CM to report diagnoses, signs, symptoms, all the reasons why a patient requires care from a healthcare professional, whether it's a physician or a hospital facility, whatever. So, we thought it might be good and fun to go ahead and go through a case scenario together and code it. Now, it'll be very helpful if you have your ICD-10-CM codebook with you so you can follow along. Let's begin with the scenario. Fiona McNally, a 77-year-old female with type 2 diabetes and hypertension, presented to the hospital's emergency department with shortness of breath of 3 days duration and was found to have an acute infarction of the anterior wall of her heart, specifically the left main coronary artery. She was admitted to have a catheterization of her heart performed. Okay, so the first thing we need to do is determine what was the medical necessity for Fiona McNally to be admitted into the hospital. So we have to go back and do what's called abstracting the case scenario. This means we're going to read through the entire physician's notes to identify what relates to why, W-H-Y. Why does this patient need to be admitted into the hospital in this particular case so she can have care? As we look through, the first thing that you'll notice is she has type 2 diabetes, mellitus, and hypertension. But those conditions, in and of themselves, are not a reason to be admitted into the hospital. So keep reading. And it's always important to read the entire case notes completely and carefully. We picked out something very short because you're just learning, but a lot of times these case studies, these patient charts, the documentation are very long. So you have to just use your patience and read through it all carefully. So as we continue to read, we notice that the reason she came to the emergency department was because she had a shortness of breath of 3 days duration. And then we see that she was found to have an acute infarction of the anterior wall of her heart. An infarction is commonly known as a heart attack. So that would be a reason to admit her into the hospital. Absolutely. So let's go ahead and find out how to report this with an ICD-10-CM code. So she sought help because of the shortness of breath, but that was a component sign of the infarction, the heart attack. So upon examination, the physician confirmed she had an acute infarction of the anterior wall of her heart. So the main term there we're going to look for in the alphabetic index is infarction. Acute means severe, so that's not something, that's not a condition. That's a severity, a level of a condition. The anterior wall of her heart is an anatomical site. That's not a condition. So that leaves you with infarction. So turn in your in the alphabetic index of your ICD-10-CM code book and look up infarction. You will notice a long list of anatomical sites that are listed as to where the infarction was located. When you read these notes about Fiona, you see that the infarction was located in her heart. But when you get to heart, it tells you to see infarct myocardium. So that means we're going to stay right here with the same main term, infarct, but we're going to keep reading down this alphabetical list of anatomical sites all the way until you get to the word myocardium indented underneath infarction. And you'll see it says myocardium, myocardial, acute. Okay, we're on the right track, right? With stated duration of 4 weeks or less. Do you remember? Well, you know what? You don't have to remember because you just go back to the scenario and that will refresh your memory to be accurate. And you will see that it's only been 3 days, which is less than 4 weeks. So the index recommends code I21.3. So now let's turn to the tabular list in ICD 10-CM. You should always start reading at the 3-character level in the tabular index because there are all these notations that may help you know if you're in the right place or the wrong place, or if you need an additional code or not this code or whatever. Okay, so it's really important that you train yourself, build this habit starting right this minute to begin reading at the 3-character level. And in this case, that's going to be I21 that says ST elevation STEMI and non-ST elevation NSTEMI myocardial infarction. And then there's an includes note that says myocardial infarction specified as acute or with a stated duration of 4 weeks, 28 days, or less from onset. Again, it said specifically that Fiona only had this for 3 days, so we know we're now in the right place. So with confidence, we can now look through at the 4th character. And if we go directly to the code that was suggested by the alphabetic index, you take a look at the whole code and you'll see I21.3, ST elevation STEMI myocardial infarction of unspecified site. Well, wait a second, that's not accurate. You notice, and again, you need to go back to the scenario because a specific site was mentioned. Let's take a look. We go back to the documentation and you'll notice that it says the acute infarction was in the anterior wall, specifically the left main coronary artery. That's not unspecified. That's very specified. So now in the tabular list under I21, you need to read all of the 4th character and 5th character options and take a look and look to match the terms from the documentation to the code descriptions. And you will find I21.01 ST elevation STEMI myocardial infarction involving left main coronary artery. Oh my gosh, that's perfect. It matches perfectly to the physician's documentation. So now you can report this code with confidence because you matched what the code book said to what the physician wrote or documented. And that's what we do. Excellent. Are you done now? Were there other reasons to admit her and there weren't any other reasons to admit her, right? I mean, the documentation was clear that solely the problem with her heart was the reason to admit her into the hospital. So the catheterization of her heart could be done, and the catheterization that was mentioned is a procedure which will be reported with a procedure code. So that has nothing to do with ICD-10. The myocardial infarction explains the medical necessity for her admission into the hospital, and it explains the medical necessity for performing the catheterization. So, are we done? Well, we're not done because while Fiona is in the hospital, the physicians and the nurses and everybody who care for her must attend to the fact that she has type 2 diabetes mellitus and she has hypertension. This will affect her diet, what she eats while she's in the hospital. If she has regular medications for either of these two conditions, those need to be given. And the hospital cannot just give patients medication without a good reason. So we need to document these conditions. Both of these conditions are what are known as systemic conditions, and that means that they affect the entire body. So they virtually always are reported when a patient has been diagnosed with them, regardless of the specific detail for the procedure or for the admission. So let's go ahead and take a look. Back to the alphabetic index of ICD-10-CM and look up diabetes, diabetic mellitus, sugar, and it gives you E11.9. But we know from the documentation that she specifically has type 2 diabetes mellitus. So read down the long list, it's in alphabetical order, and find T for type 2. And all that work for nothing? No, it's not for nothing. It suggests the same code though, but now you know you're in the right place. Let's turn to the tabular list. In the tabular list, we're always going to start reading at the 3-character level. And E11, E11 is described as type 2 diabetes mellitus. So we know we're in the right place. Read through all of the 4th-character options, and you'll find the best one is E11.9, type 2 diabetes mellitus without complications. The problem with Fiona's heart is not a specified complication of diabetes mellitus, and there's nothing else mentioned. So we know with confidence that we can report type 2 diabetes without complications, E11.9. And next, we have to look and find the code for hypertension. Back to the alphabetic index of ICD-10-CM, and you will find hypertension, hypertensive, accelerated, benign, essential, idiopathic, malignant, systemic, I-10. All right, let's go to the tabular list and find I-10. It's a good thing we always start with a 3-character code because that's all we have here. I-10, essential primary hypertension, includes hypertension, arterial, benign, essential, malignant, primary, systemic. We're good. We have no other information about her hypertension, so this is the perfect choice. So now you can see we have 3 ICD-10-CM diagnosis codes to report to explain the medical necessity for the care that Fiona will get while she is in the hospital under the care of the physician and the entire facility. You're going to report I21.01 as the first code because that's not only the most important thing, that's the reason she was admitted into the hospital, followed by E11.9 and I10 to support the reasons for the rest of the care that will be provided to Fiona while she is in the care of the hospital. Perfect. If you have any questions, please post them to the Q&A discussion forum. Trust me, if you ask, there'll be 10 other students in the class going, "Oh, I was wondering the same thing. I'm so glad they asked that question."